Welcome to this section of the course where we take a deeper look at how trauma is defined and understood. In particular, we'll explore the language of big T and small t trauma. These terms are often used to help differentiate types of experiences that can result in a trauma response. Our goal here isn't to diagnose or label, but rather to expand our understanding of what trauma can look like for different people and why that matters in our coaching practice. So, what exactly do we mean by big T and small t trauma? These aren't clinical diagnoses. They're informal terms developed within psychology and coaching to help us talk about the range of experiences that can be traumatic. Big T trauma generally refers to experiences that are life-threatening or profoundly disturbing. Small T trauma involves events that are not life-threatening but still deeply impact someone's emotional well-being. This distinction allows us to hold a wider, more inclusive lens. Trauma isn't just about catastrophic events. It can also be about the ongoing, smaller experiences that chip away at our sense of safety, identity, and connection. The big T small t terminology has roots in clinical and developmental psychology. It was popularized by professionals who needed a way to communicate the difference between large-scale traumatic events and more chronic, cumulative forms of stress and harm. One of the earliest mainstream uses came from therapists and trauma specialists seeking to validate experiences that didn't meet criteria for PTSD but still had lasting impact. Over time, the language has become more common in trauma-informed education and coaching. However, while these terms can be useful, they are not universally accepted, and it's important to use them with care and context. Let's look at what typically falls under the category of big T trauma. Natural disasters, physical or sexual assault, war and combat, serious accidents, sudden loss of a loved one. These events are generally seen as traumatic across most contexts and often result in symptoms aligned with PTSD or complex trauma. But remember, not everyone responds the same way. One person may be deeply traumatized, while another might not be. It's not just the event, it's also the impact. Now let's look at what we might call small t trauma. It could be ongoing emotional neglect, bullying, being overlooked or dismissed repeatedly, microaggressions, breakups, or relational betrayal. These experiences can accumulate over time and create deep emotional wounding. They often go unrecognized because they aren't dramatic, but they can still profoundly affect a person's nervous system, beliefs, and capacity for trust. In coaching, this is often where you may encounter clients' internalized self-doubt, shame, or blocks to growth. Let's pause here for a moment. Take a breath. Have you ever dismissed something you went through because it wasn't that bad compared to what others have experienced? What about your clients? Just take a minute to reflect or jot down anything that comes up. This is a good moment to slow down and check in. The big T small t distinction can be incredibly helpful in coaching. It helps to validate a wide range of experiences, name what often goes unnamed, normalize the idea that trauma isn't always visible or dramatic. By acknowledging that trauma comes in many forms, We reduce shame and invite compassion. We also make room for clients who may not have ever considered that their struggles are trauma related, but who are experiencing very real emotional and nervous system responses. At the same time, it's important to be cautious. This language can also unintentionally create a hierarchy of suffering. It can suggest some pain is more real or valid, and it can lead to minimization or comparison. Also, trauma is not binary. The nervous system doesn't classify experiences as big or small, it responds to threat. So while the distinction can help us communicate, it should never be used to judge or categorize a client's experience. As a trauma-informed coach, your job is not to evaluate or label trauma. It's to create a space where your client feels safe, respected, and validated. You might never use these terms out loud in a session, but having this awareness helps you to listen more sensitively and recognize what might be shaping your client's behavior, as well as avoid inadvertently minimizing something that matters deeply to them. So stay open and stay curious. Trust that even subtle pain deserves care. And a quick reminder, this model is just one lens. It can be helpful, but it's not perfect. Your role is to meet your clients where they are, not where you think they should be. Trauma is very complex, it's layered, and it often doesn't look like what we expect. As you work through this course, let this section remind you to listen for impact, not just events, and to hold your clients' stories with deep care. Let's close with a few final reflections. How do you personally relate to the big T, small t framework? Has it helped you name anything in your own experience? Where might you be more attuned to small t in your coaching conversations? And how can you use this lens to increase empathy without slipping into assumptions? Take a few moments and sit with these. Feel free to pause the video, write, or just take your time.